Welcome to Real Health Chat, our stories of health, justice, and change. I'm Julie Hard, Director for Global and Community Partnership in York's Faculty of Health, and this is where we sit down for authentic conversations with the researchers, educators, students, and community partners who are building healthier worlds right here at York University and beyond. No lectures, no jargon, just real people sharing the work that's creating upstream change in our communities. Let's chat. Today, I'm joined by Parmis Mirzadeh, who is a PhD candidate in the School of Kinesiology and Health Science here at York. Parmis has been a York Lion through and through, completing her bachelor's, master's, and now her PhD, all right here in the Faculty of Health. Her research focuses on healthcare experiences and outcomes for people living with obesity, examining how systemic factors impact the care they receive. Her work has been generating attention at conferences and getting published in major journals. I'm excited to dive into what she's discovering about healthcare equity and what it means for building healthier communities. Parmis, you started here at York as an undergrad, and now you're working on your PhD, doing research at York, working with Oak Valley Health, with Sunnybrook and UHN, or the University Health Network. How did all these doors start opening for you?
First of all, I want to say thanks for having me on this podcast. I'm really excited to be here. So everything kind of started in my master's, which was about 3.5 years ago. So in the first semester of my master's, probably a month or two in, I got an email from York, which said they were looking for research interns to volunteer at Oak Valley Health. My understanding is that York and Oak Valley are partners, and they often conduct research together. So I got this email and I reached out to the manager of research at Oak Valley. We had an interview, and then a month later, I got onboarded at Oak Valley, where I got a lot of experience doing research, all kinds of research. I was part of clinical trials, did some retrospective chart reviews, got to attend the research day, and I got to actually teach a lot. I got to speak at their lunch and learns, talking about research ethics and things like that. And then after being there for a year or two, they connected me with someone at University Health Network, one of the psychiatrists who was doing research. And so through that, I got connected with UHN, and I've been doing research there ever since as a research coordinator, which, again, I get to do some real interesting, cool research, which is, again, very different from what I did at Oak Valley and also different from what I do with my dissertation, where I collect data, qualitative and quantitative, do analysis. And then in terms of Sunnybrook, when I started, one of the first projects that our lab was doing that I got involved in was in collaboration with one of our faculty members in the School of Nursing. And so I got brought on to that project, through which I actually got to travel and go to a conference in Washington, D.C. And from there, it worked out really well, and I got hired with that person at Sunnybrook, and ever since I've been doing research there as a coordinator.
So it seems like all these connections just kind of like from one thing leads to the next thing. I think when we had our conversation earlier in advance of this podcast, you had also mentioned just sort of your willingness to be open to some of these experiences. Do you think that you would be in sort of all these spaces had you maybe approached it differently?
Probably not, I would say. I got lucky. I would say that there's just so many experiences at York in that I feel, and I assume a lot of graduate students can relate to this, you kind of never say no to an opportunity. And then that opportunity often leads to more opportunities. One of the things that I think I learned early on, actually, at one of the first conferences I went to, one of the professors there was talking about how when researchers get connected with other people, it's usually that someone they worked with says, oh, I know someone who does data analysis, or I know someone who's good at recruitment or is good at grant writing or doing REB applications. And I think that's how it really works in the real world, where you work with someone and then when their colleague needs someone to get a project started at another institution, they refer you. And that's really how it's mostly worked for me, which is great. And I think just the fact that, and I don't think I've ever said no to an opportunity since I've started my master's. And it's just opened so many doors.
Amazing. On that note, through all of these experiences, you've been able to explore many aspects of research. And I'm glad you brought up your master's because, in particular, your master's thesis found some pretty striking results. And it's all related to emergency department experiences. Can you just tell us a little bit more about that research and what you were finding with it?
Absolutely. So in my master's, I did 2 research projects, and one of them was looking at emergency department experiences of individuals with obesity. So my dissertation and my thesis work is centered around obesity within the current Canadian healthcare context. And so for this research, what I did was I looked at individuals with obesity versus individuals of the same age, the same sex, and the same diagnosis in Ontario emergency departments. And I looked at some health factors and assessments and diagnosis and things like that in the emergency departments. And what I found was that compared to those that didn't have obesity, the individuals that had obesity were waiting longer to see a physician. They were given less urgent triage scores. And they were overall waiting on average 3.5 hours longer in the emergency department. And I want to remind you, this is compared to individuals of the same sex, the same age, and the same condition that was diagnosed and emerged. And so that's obviously very concerning. Mm-hmm. And the exact reasons as to why that's happening, I'm not sure. But clearly, these findings highlight disparities in care. And it's quite shocking because you would expect that someone who has obesity, right, they have a disease and are likely to have worse outcomes. And so you would expect that they would be given a more urgent triage score. But that wasn't the case. And so these things are concerning.
Well, what picture then do you think emerges about how these disparities are affecting people in the population and in terms of personal health and well-being? What are you thinking about that?
So specific to obesity, I don't think so as far as I know, there's nothing out there that shows individuals with obesity waited longer, and then that led to worse health outcomes. It is very possible that while they're staying there longer, they're getting assessed further, maybe instead of relative to the person that doesn't have obesity, maybe they're running more labs on them, they're getting more scans, or maybe it is that they're just caring for them more. So we don't know exactly what that looks like, but I think looking at broader research, we have seen staying in emergency departments longer leads to worse outcomes. Specifically, there is a paper that I read earlier, and I don't want to quote exact statistics, but there's something that shows where every hour of waiting in emergency departments leads to X increased risk of mortality. So we know staying in emerge is associated with waiting longer in emerge is associated with worse outcomes. And so that's obviously concerning when it comes to persons with obesity, where we know the obesity is associated with comorbidities and other signs and symptoms, and they already have increased risk of mortality from their disease. And so the fact that they're waiting longer is concerning.
Are there a lot of people that are doing research in this area?
So obesity was only recently, I would say, not that recent, but it quite recently recognized as a disease. The Canadian Medical Association recognized it as a disease in 2015. And the American Medical Association recognized it as a disease in 2014, so just a year prior. And so I would say, compared to other diseases, there's for sure a lack of research. And that can also, I mean, it definitely stems from bias and stigma as well. I mean, there is definitely less funding for doing obesity research relative to some other similar diseases, such as diabetes and cardiovascular disease, which obesity is a risk factor for. So I would say definitely, and even within our faculty, we have quite a bit of researchers who study obesity, but I would say it's still not enough. There's a lot of unknowns with obesity. And that's actually why I'm really interested in studying it, because a lot of the things that I explore, you would think that people have already explored and know the answers to. But I think the more we learn, the more there is to learn with obesity.
Yeah, for sure. One other thing I wondered about, because these findings are startling in terms of the disparity. And so just when you're presenting your research and your work in this area, what kind of reactions do you get when you are presenting in conferences or from the papers that you've written? What has been sort of the uptake and the reception from both healthcare workers and other researchers?
Yeah, so this work specifically, my master's work, I've been able to present it at obesity conferences. So I've presented them at Obesity Canada's Summit, as well as Obesity Week in the United States. And so my audience was individuals, physicians, researchers, community members, generally people who are interested in studying obesity and know a lot about obesity. And so there wasn't much of a surprise when I showed them these findings. But I have presented this at my master's thesis defense. I've presented this at the second stage of my cognates. And I've presented within our own school during graduate seminar. I've presented it recently at Broaden Horizons and the Health Research Day within the Faculty of Health. And so where the audience consists of people who are not studying obesity, they are quite surprised. And they always kind of ask me to rephrase what I said, and just to make sure that they're hearing me properly, that people with obesity are waiting longer. They are seen as less urgent cases. And so I feel they're always shocked and asking me why I think we might be seeing that.
So why do you think, or what kind of explanations are provided by healthcare providers and maybe even in the communities that do know the subject area? What is your answer to the question why these things are actually happening from what you know and what you suspect?
Yeah, so I myself was quite shocked with the findings. So I had to do a little bit of research, but at the same time, I had to speak to healthcare providers to understand. I spoke to a lot of healthcare providers to understand why they think we're seeing these differences. And the things that I've heard most commonly is that there might not be enough bariatric equipment. And what I've seen from the research is that there was a study done in the United States where they interviewed nurses and physicians in one of the hospitals, and they found that they were saying it's harder for them to take blood pressure measurements. It's harder for them to find anatomical landmarks. And so that could be a reason that it's taking longer to care for persons with obesity. And even speaking to some of the nurses in our faculty, I've heard that all the training that they do, taking blood, finding anatomical landmarks, even taking blood pressure, they were taught to do it on dummies that were of a normal size, right? And so it's a little bit harder in practice because that's not what you're typically seeing. And so I think I've heard there's a possibly lack of equipment. There's bariatric.
But that can't be the only reason.
Of course not. I think there's also for sure bias and stigma, right? I think when you come into emerge as a normal weight person and you complain about breathing problems, that your triaging nurse might say, okay, well, there has to be an underlying respiratory problem. But if you go in complaining of breathing issues and you have obesity, they might say, okay, that's probably because of their obesity. And so that might be why they're giving them less urgent triage scores, which is leading to longer wait times, probably. So I think there's an interplay of many factors, and I'm hoping to uncover that in the future.
Well, let's talk about your future, because you're now in your PhD. And in your dissertation work, you're expanding to look at healthcare utilization, satisfaction, needs, plus that bariatric preparedness in Canadian hospitals that you had mentioned. So what are you hoping to reveal, or what are you really looking for in your current work as a PhD?
I'm really glad you mentioned that, because I didn't go into my master's thinking I was going to do a PhD, but having found what I found, I was really interested in the topic, and I kept asking why, and people kept asking me why. So I'm trying to move that research forward. And so for my dissertation, I'm looking at healthcare utilization trends of Canadians across different weight categories. And I'm looking at whether they are satisfied with the current healthcare system, whether their needs are met, how long they're waiting for procedures and those things, just to see if these factors differ across different weight categories. And then at the same time, I'm going to be working with some healthcare providers to uncover the bariatric equipment piece to see if our Canadian hospitals are equipped to care for individuals with obesity, which is a very important thing considering that the prevalence of obesity is rising.
That's great. I'm going to ask you now to kind of look in your crystal ball, or maybe give us your thoughts on how do you see that we could bridge the gap between identifying these problems and actually creating change. Maybe it's not a fair question as a researcher, but what do you think about that?
So I think the first step is education. I think everyone needs to be educated about obesity and the fact that it is a disease. A lot of people have bias and stigma because they believe obesity is caused by physical inactivity and poor diet. But we know through research that that's not the case. There are many factors that play a role, such as genetics. And so I think the very, very first step is to address the bias and the stigma, and that we can do through education and knowledge.
Are there any people, institutions, or groups that you wanted to just give a shout out to, or to acknowledge in the work that you've done that has brought you this far?
For sure. Yeah. I would like to thank my supervisors. So I was supervised for my master's thesis by Dr. Chris Ardern, and he supported all the work that I talked about today. And now through my dissertation, I'm supervised again by Dr. Ardern and Dr. Jennifer Cook, and I'm grateful to both of them. All this work is basically possible because of them, and York University and our amazing lab. From the undergrads that we have in the lab to the master's and PhD students as well. I would actually like to acknowledge some of the people that I've worked with. So at Oak Valley Health, the manager of research, Michelle Dimas, at University Health Network, Dr. Rima Styra. She's been super great, and it's been amazing working with her. And at Sunnybrook, Dr. Trina Buick. She's been very, very supportive, and I'm very grateful to all these people.
Great. Okay, I'm going to change gears a little bit. This has been a really valuable and insightful conversation about healthcare and healthcare equity. But before we finish up, I'd like to end on a few fun rapid fire questions. So you don't know these are coming, but I'm going to ask you 4 questions, and just whatever comes to mind, just to learn a little bit more about you, Parmis. So the first question is, can you name one healthy activity you think everyone should engage in? Rapid fire.
Getting their sleep.
Oh,
yeah,
okay.
7 to 8 hours of sleep.
Okay. Name one health trend that you will never subscribe to. Ooh.
Don't know. That's a good question. That physical activity cures obesity. I think
that's a good one. It's right on point in your brand. Okay. What's one health myth that you believed in for way too long?
Health myth that I believed that physical activity cured obesity, or it was.
When did you let go of it, by the way?
My master's.
Wow, it took all of the study and the education piece that you were talking about. Okay, last question. True or false? Tim Hortons coffee counts as a health intervention.
False.
Okay.
Intervention.
Are you a coffee drinker?
Yes.
Oh, interesting. And she still holds true to the no, to the false. Okay, so thank you so much once again. That's a wrap on this episode of Real Health Chats. Parmis, thank you for sharing your incredible work and insights with us today. How can people actually, if they're really interested in learning more about your work, where would they look? What advice do you have? Or are there ways of contacting you, or websites or research that you wanted to share?
So my York email is always open. It's my last name at YorkU.ca. Our lab website is a little bit outdated, so I'm not going to give the link to that. But yeah, I think even if you search my name, York University, a bunch of things come up.
Great. Thank you. Real Health Chats are produced right here from York University's Faculty of Health in the Real Health Studio. For everyone listening, if today's conversation resonated with you, we'd love to hear about it. And if you're working on something that's building healthier communities, we'd love to hear about that too. Send us an email at eehealth@yorku.ca. Until next time, this has been Julie Hard, and we'll chat soon.